I would like to know that this method of rectal insufflations is rather cheap, and for some category of population, it is very important. But as for Russia, we prefer mostly intravenous injections. I don't know why, maybe because of the psychological reason, maybe for the religion reason, but I know that in other countries it is more preferable to use rectal insufflations, and in Russia they prefer to use it with small children or elderly people. And I'd like to know that this method is rather efficient with skin diseases because internal organs must be cleaned as well. There are some questions from our foreign partners and from WhatsApp, and I will answer it later. The thing that you have read about gas injection of ozone, it was an experiment that they made on the animals, and there were no metastases because it was a case with sarcoma 45 in hip area. So I would like to emphasize that it was an experiment made on animals, and I couldn't recommend to use the results of the experiment on the patients, but it depends on the stage of the patients, whether it is a final stage of the disease. You could use it. The concentration was 2.5 milligrams per liter, and but there was no metastasis in that case, and we used it directly in the tumor area. As for prickling the tissues around, and the results were nearly the same. In Russia, we also use the combination method of PRP therapy together with ozone method, but we do it in a consecutive way. First, we conduct the ozone procedure, and then we add the mesotherapy with medicines or hyaluronic acid. You can do it in one day, but in a consecutive way. There is also a question how to make the parameters of oxygen with different values. Initially, you may put the flow from 1.2 up to 1.5 liters per minute, and you could get a concentration up to 10 milligrams per liter. If you want to increase the concentration of ozone in some special procedures, you must decrease the oxygen up to 0.3 liters per minute. What is the method of injecting the ozone with prickling the head? So the answer is the technique of injection is the same as for mesotherapy. We use the needle 30G, and the angle of cutting is 30 degrees. We put it into the cutting area. And I would like to remind you, if you want to combine ozone therapy and the other techniques, first you must put ozone and then add mesotherapy or other methods. I want to start with the psoriasis case. During all my practice, I had 13 patients with psoriasis, and I wouldn't recommend at all to prickle this case. As psoriasis is an autoimmune disease, that's why we must treat it very carefully, as we do with pregnant women and breastfeeding women. And the dosage of concentration will be much lower. So we could use the ozonated physiological saline or ozonated oil. And at this stage, the treatment with ozone is over. You don't have to wait for a quick result, but when you keep treating with ozone, the result will be stable. And after the second course of ozone, you may have this result. There is a course of 8 procedures, and after 3 months, you may repeat it and see a remission of the disease. As a result, we get the decrease of pain in a joint area. Also, the state of the skin will be better, and the skin will be more pure. As for the quantity of procedures, if we speak about the local treatment for the face or body, usually it is no more than 10 procedures. As for the depth of injection of ozone, we take all the length of the needle from 12 up to 16 millimeters. And in the video, we have showed you how we take the skin of 2 centimeters, and in this area we put an injection. In the experiment of animals, we have used only external tumor prickling with gas ozone injection. We haven't used the intravenous injection. The intravenous physiological saline injection was made with the patients with the cancer of the breast. So we saw the good results in the efficiency of the immune boosting when using ozone therapy. But I would like to note that there was a combination of ozone method and chemical therapy. It was a combination method, and there were 2 groups of patients. The first group was treated only by chemical therapy, and the second one was treated with ozone therapy and chemical therapy as well. And positive results were rather bigger in this group. Regarding the disease was rather severe. It was the 3rd or 4th stage of the cancer. So yes, it's possible to use ozone therapy with disease of blockage of sebaceous glands. You may inject directly in the area of cyst, and you may see the results in the state of skin. It will become more pure. The concentration is 5 milligrams per liter. You have to conduct the procedure 2 times per week, and the course is up to 10 procedures.
из-за технических нетрудностей мы внутривенную капельницу делаем в бабочках. Из-за этого скорость резко снижается. Вот этот трехиголочный метод, я говорю. И процедура продолжается больше часа. И мы используем не 20, как далее, миллиграмм на килограмм, а 15-10. Низкий канцер. Беременный по 500. Ну, хороший эффект дает. Что скажете на это? Больше часа.
As for intravenous injection with butterfly equipment, the speed of the injection is decreasing with the 3 needles method, and it may take about 1 hour. They use from 10 up to 15 milligrams per liter, and from 300 up to 400 micrograms per liter for pregnant women. As for pregnant women, they recommend to use a lower concentration of ozone, but the time will be expanded up to 1 hour. But it won't make harm to the pregnant woman because the concentration is low, and the doctor says that the results are quite positive, and the state of the health is improved. As for headache and COVID as well.
Будет хороший, но концентрация низкая. Вы не навредите вены, не повредите у больной. Все будет очень хорошо. Я знаю, что прекрасные результаты у беременных будут.
Спасибо большое.
So we treat it perfectly with the gasation of nasal passages. There are no contraindications. The procedure may be held frequently, 1 time per day, for example. The concentration is 3.5 milligrams per liter. The course is up to 6 procedures. It may be injected in eardrum as well. So the answer is about the pathogenesis of respiratory passages. It is preferable to use it in a prophylactical way to bury the ozonated oil when, for example, when you had some contacts with possible people who have some disease as COVID, and you may use the ozonated oil. It has a perfect result, as Claudia Nikolaevna remarked in her own example, because she contacts with many persons, with students of medical institute, and it is a very good medicine to prevent the runny nose or viruses as COVID, because the ozone it has the lipids, and it will oxidate the virus. So as for COVID, I would like to add that what is the main thing in COVID is lack of oxygen. And as we use ozone, is a very good treatment for the tissues that suffer from hypoxia. And we inject the ozone-oxygen mixture. It is the first advantage. And the second is the hypocoagulation method that is used with ozone. For example, for the clots of vessels of a human brain, it may be ozone may be used, and also it has the fibrolytical effect. And if a person had a COVID, and during the rehabilitation, it may be used as well to restore the whole organism. Thank you, dear colleagues, everybody who has joined us today. I would like to remind you that the next meeting will be held the 19th of October at the same time at 10 hour by Moscow. I will send you the notification in the common group. And if you have any other questions, you may send it to our chat in WhatsApp and we will answer them.
Всего наилучшего.